Hello friends, this is Dr. NAVIN Agrawal. I am an interventional cardiologist practicing at Valsad and Vapi district of Gujarat. My topic for today's discussion is regarding the symptoms of diabetes. Diabetes is an extremely common disease which with a prevalence of almost 10 to 15% of the total population, especially the middle-aged and the elderly population are very prone to have diabetes. I'll be discussing what exactly are the symptoms of diabetes which you can use to recognize the problem early. Because a large majority of the patient, when they come to us for the management of diabetes, it is already a disease which is for several years in their body, and it has already done the damage before we start the treatment. Because routinely what is recommended that people should get their blood sugar checked up every 3 to 4 months to get the detection of diabetes. But in large majority of the cases this is not practically possible, and people don't get a regular checkup every 3 to 4 months and don't get their blood panel workup every 3 to 4 months, because majority of the cases India is considered the diabetic population of the world, and majority of the population are so poor that doing a blood checkup or a full blood health checkup panel every 3 to 4 months for the entire family may or may not be practically feasible for everyone. So in this topic I will be discussing the symptoms of diabetes which will help you to detect whether the body is having early changes of diabetes or not, and based on these you can pick up the symptoms and get your blood panel worked up if at all you have any of these symptoms or multiple of these symptoms are there, and then you can decide whether you have to see the doctor or not based on these symptoms. Diabetes mellitus is a condition where the body is deficient in insulin in the body, and insulin is the hormone which controls the blood sugar levels of the body. It usually, if the body is deficient in insulin, the blood sugar levels tend to spike up, and the fasting blood sugar, that means the early morning blood sugar sample, goes up beyond 125 millimeters of 1 mg per deciliter. If the blood sugar is checked up after the sugar has been taken in by the patient, then the sugar level is beyond 200. By definition, if the fasting blood sugar is more than 125 and the postprandial sugar is more than 200, that is considered diabetic. Some patients where the fasting sugar is between 100 to 125 and the postprandial is between 125 to 200, these patients are considered pre-diabetic, and some patients of these may or may not have symptoms based on the body tolerance levels. The problem with diabetes is that once the body gets this extra sugar, the sugar starts to act on various systems and various cellular level. It tends to react with various enzymes, and various end products and toxic end products start to get formed. These are known as glycosylated products or sometimes glycosylated proteins. Once these proteins start to accumulate in the body, they get deposited at various areas like the kidney, the liver, the heart, the brain. These products start to get deposited in various areas and start to cause damage to the system. The atherosclerotic process also and the deposition of the cholesterol in the blood vessels also is very rapid in these patients, because insulin plays a lot of role in the metabolism of sugar and cholesterol both at the same time. And in these patients also the cholesterol deposition of the blood vessel is much higher, and a lot of these patients die because of heart attacks and brain strokes. I'll be discussing the symptoms of diabetes, and in short, once you have these symptoms, then you can recognize that you can have early diabetic phase and you can go to your doctor and get yourself checked up. First important symptom is feeling hungry. The patient with a diabetes cannot have a very stable blood sugar levels, and the sugar levels tend to fluctuate, and these patients will keep on feeling hungry at various points of time. During multiple points of the day, they will keep on feeling hungry, and the hunger will be so extreme that they will start to get hypoglycemia symptoms also, and they will have extreme craving for the food, uncontrollable craving for the food. If this is uncommon and not what is seen in routine people, then the patient should consult the doctor. Similarly, the patient will feel thirsty also, because insulin deficiency causes the excessive sugar to go down the kidney, and a lot of this sugar is filtered into the urine. Once the sugar is filtered into the urine, the body also starts to get dehydrated, because to flush out this sugar a lot of water is also required, and that excess water keeps on going into the urine. If the body becomes dehydrated, then the urge of drinking water also keeps on increasing, and the patient will keep on feeling thirsty at multiple points of time in the day. If this is also there, then you should consult your doctor. Third most important symptom is tingling or paresthesias or burning sensation in the palms and the soles of the extremities. If at all the patient is developing burning sensation in the legs, or paresthesias or numbness, or sensation of insects crawling on the body, if at all these sort of paresthesia or neuropathic symptoms are there in the body, then the patient should get himself evaluated for diabetes, because diabetes is a very common condition where the patient develops these small fiber neuropathy symptoms, and if any sort of this symptom is present, then the chances of the patient being diabetic is very high. Next important symptom is extreme exhaustion. The patient tends to feel very weak and very exhausted and very fatigued, and if at all this is present and if the capacity of the work of the patient is deteriorated over a period of time, then he should get himself evaluated for diabetes. Similarly, the patient will feel weak and fatigue will also be there, because whenever the patient exercises, then the stamina will go low because of the low blood sugar levels, and the patient fatigue onset will be much rapid as compared to what is in routine times. So if at all this is also happening, the patient should get himself evaluated for diabetes. Next is slow healing of the wounds. Usually diabetes affects the healing of the wounds, and if at all the patient gets injured, then in a routine patient, if the wound heals in 7 days, then in diabetic patient the healing of the wound will be delayed by maybe around 10 to 15 days, and sometimes the wound will not heal completely, and the patient is much more likely to get infection in the wounds also. If any of this is noticed by the patient, he should get himself evaluated for the diabetes. Unintentional weight loss is seen in diabetes because insulin controls the body weight also. So some patients will develop unintentional weight loss. That means that patient is not exercising, he is not on any crash diet, but the body weight starts to fall by maybe 5 to 10 kgs. Usually 10% of the total body weight loss, if it is occurring, that is considered significant. That means that if the patient's body weight is 70 kg and it drops by more than 7 kgs over a period of time, then it is considered significant. Maybe 1 or 2 kg weight loss, if it is there, that it may or may not be considered significant. But if it is more than 10% of the total body weight, then it is considered significant. Similarly, patient can have weight gain also. Sometimes if the patient is having excessive hunger and he starts to overeat, then the body weight increases dramatically, because the patient does not feel and does not realize that fact that he is overeating, and because of this increased hunger, he keeps on eating at multiple points of the time, and this leads to increased risk of weight gain also. So if unexplained weight gain is occurring and the craving for food is increasing, then the patient should be evaluated for diabetes. Next is sexual dysfunction. Male patients might develop erectile dysfunction, and frigidity might be seen in females because of decreased secretions in females, and male patients will have decreased libido, and the erectile dysfunction, that means the strength in the sexual organs while they are performing the sexual activity will reduce. So if at all that is there, that is considered a part of the diabetic neuropathic pattern and the diabetic vasculopathy pattern, and this, if at all it is there, should be considered a symptom of diabetes, and the patient should get himself checked up. Next is increased blood pressure. If at all the patient is having increased blood pressure, hypertension is seen in large majority of the patient who are having diabetes. So it happens because of the effect on diabetes on the blood vessels and on the kidney. So if at all the patient's blood pressure starts to get shooting up, and the patient is getting new onset hypertension, which was not there earlier, then high chances that the patient might be diabetic also, and the patient should get himself evaluated. Next is eye damage. Diabetes affects the cornea, the retina, and the lens of the eyes in multiple ways. The cataract formation of the eyes is also common in these patients. So if at all the patient is developing blurring of vision and the vision of the patient is deteriorating, especially if the patient is middle-aged or elderly patient, he should get himself evaluated for diabetes, because the incidence of eye-related problems are much more common in diabetic patients, especially the disease affecting the lens of the eye and the retina of the eye. Next is skin changes. Some diabetic related skin spots and black pigmentation of the skin and skin related rashes are also much more common in diabetic patients. There are some specific rashes, if they are seen on the body, they are considered characteristic feature of diabetes. If any of the skin changes are apparent in the patient should get himself evaluated for diabetes, and blood sugar level should be checked up. Next is the patient getting candida or fungal infection in the genital region. If at all the patient is having genital infection and the fungal infection is seen in the perineal region of the patient or in the genital region of the patient, then sugar level should be evaluated. Next is immunity decrease. If the patient's immunity is decreasing and the patient is developing recurrent infections and recurring cough, cold or other immunity related problems are occurring, then it should be considered one of the feature of diabetes and it should be evaluated. I am not saying that it's a very specific feature, but it is one of the features. All these symptoms are not very specific that if at all this is happening, the patient is a sure shot diabetes. That is not the case. You should get yourself checked up, and there are some maybe 10 to 20% chances that test for the sugar levels might come positive. Next is increased irritability and mood swings. Although this is not a specific symptoms, but diabetic patients, especially the new onset diabetic patients, will be having more mood swings, and these patients might be more depressed or more agitated or more irritable. and if at all this is present in a new onset patients, then they should be evaluated for diabetes. Although the specificity of the symptom in a diabetic patient is very low, but at least some patients will have this symptom. Next is a foul smell in the breath or a fruity smell in the breath. That is considered a sign of diabetic ketoacidosis, that means excessive sugar in the body. If this is present in the body, then the patient should be evaluated for diabetes. Some people might develop postural hypotension. Postural hypotension is also a feature of diabetes. This means that if the patient develops sudden onset dizziness or feels lethargic when he is getting up from a sitting position or sleeping position, especially early in the morning, if at all the symptom is there, that is considered a sign of postural dysfunction or autonomic dysfunction of blood pressure regulation system of the body, and this patient should get themselves evaluated for diabetes. These are the things which are very commonly associated with the diabetes, especially increased hunger, increased thirst, paresthesia in extremities, and slow healing of the wounds. These are the most important features of diabetes, and if at all anything is present, then the likelihood of diabetes is much higher than in these patients, and all these patients should be evaluated. Any of the complications of diabetes, if at all the patient is having any heart attack or any stroke or any kidney damage, these are the very patients where diabetes evaluation should also be done, because large majority of these patients will develop a heart attack and the doctor or the patient will never know that the patient was having a diabetes if at all the patient is not evaluated for this. So any patient who is developing a heart attack or patient is developing a stroke or brain related problems or kidney related problems or eye related problems should be evaluated for diabetes, and should be repeatedly evaluated. If at all the blood sugar initially also comes normal, then the repeated evaluation of this patient should be done at multiple points of time. If at all the patient is developing hypoglycemia, that means the patient is feeling extremely lethargic and the sugar levels is getting very low, and the patient is feeling dizzy, increased risk of hunger and thirst are there. A patient is feeling extremely tendency to sleep and very extreme lethargy is there in the patient, then this is considered the symptom of hypoglycemia, and if it is there in the patient should be evaluated for diabetes. In a patient who is already known to be a diabetes also, this is a very important symptom, and if at all anything like that is present, the patient should immediately take glucose powder should be taken by the patient. So chocolates, biscuits and other complex carbohydrates are very slow to act. Sugar powder and all is very slow to act. So glucose powder should be taken by this patient. They should dissolve it in water and take it, or take it directly if at all any symptom like this is present, even in a known diabetic patient also. Then the symptom of diabetic ketoacidosis, which is a complication of diabetes, is that the patient will develop severe nausea, vomiting, abdominal pain will be there, acidotic breath will be there, BP will drop down, patient will feel extremely dehydrated. These are, if at all any of these symptoms are present, then the patient should get himself admitted immediately and get the blood sugar levels done, because if anything like this is present and the patient is hyperventilating, that means breathing difficulty is there, then the patient is very high chances to have a severe diabetes, and diabetic ketoacidosis might be there. This is especially important in young people or young children where type 1 diabetes is present, because this is a condition where the insulin is deficient in the body, and the patient will come to you with severe abdominal pain and lethargy and vomiting, and if at all this is present and the patient is evaluated for diabetes, then the chances is that the sugar levels will be very high. Similarly, in hyperosmolar ketotic coma also, the patient will have acidosis, acidotic related symptoms will be there, and symptoms of lethargy, fatigue, inability to concentrate will be there, and very high chances that the patient will develop mental imbalance and might go into coma also. So if at all the symptom is there, that the patient should get himself evaluated for diabetes in such scenario. Now, when does diabetes patient require admission? If at all the patient is developing any severe complication of diabetes like diabetes ketoacidosis or diabetic infection is there, or hyperosmolar ketotic coma is there, or heart attack or any stroke related problems are there, which are common complication of diabetic patients, then the patient should be admitted in these scenarios. Usually just for blood sugar control, it is not required to admit the patient, but if the sugar level is beyond 400 or 500 and evidence of target organ damage is there, then very high chances that the patient requires admission, and the patient requires insulin infusion or aggressive insulin management to control the diabetes. Usually majority of these patients are not managed with tablets, and majority of these patients, once they are admitted, they are given insulin, rapidly acting insulin, to control the sugar levels, and once the sugar level becomes controlled, then they are discharged, and further management might be done with insulin or with medicines depending on the sugar levels of the patient. In this topic, I have tried to discuss the problems with diabetes and the symptoms of diabetes. If at all you have any of these symptoms or any complications with diabetes, you should rush to your doctor and get yourself evaluated. Although practically speaking, it is very important that every patient should get himself evaluated irrespective of the symptoms every 3 to 4 months, because this is a very common disease and a very high prevalence is there, especially if the patient is having a strong family history or if the patient is having risk factors. Then repeated evaluation should be done at least every 3 to 4 months with the fasting and postprandial blood sugar level should be done. But even if you cannot afford a repeat blood test, then also if any of the symptoms are there, then you should get yourself evaluated, and the earlier the disease is detected, the better it is for the patient, and the condition of the patient will be better if the disease is diagnosed early and treated early. The purpose of my channel is that I wish to make scientifically correct and useful information easily available to you, so that you can manage your patient better and you can discuss the disease better, and you can detect the disease and manage the patient on an aggressive basis if you understand the course and the problems of the disease. Usually for this sort of information, people tend to depend on their doctors and their friends and relatives. Doctors, because of time constraint, may or may not be able to give you all the information, and friends and relatives, usually because of lack of information, they will give you partially correct information, and following such information might sometimes be detrimental for the interest of the patient, and the patient's condition might actually deteriorate if you follow the instructions of your friends. If at all you like the concept of my channel, I would request you to subscribe to my channel, to like my videos, and to share the link of the videos with your friends and relatives. In the end, I am Dr. NAVIN Agrawal, and I sign you off. I'm signing off, and I'm very thankful for you for a very patient listening, and I hope that I was successful in making the topic clear to you. The people who are new to my channel, I would request them to subscribe to the channel, as this will give us a lot of inspiration and motivation to continue the good work as we are doing now. Thank you.